In this video, you're going to learn about the most effective 1-minute stroke test for seniors that could literally save your life or the life of someone you love. Whether you're 60 or 85, this simple test can help you spot early stroke signs in elderly people before it's too late. We've spent hours researching the fast stroke test, a proven method trusted by neurologists and emergency doctors worldwide. It's the same stroke test we've seen used in hospitals, and the same one many stroke survivors over 60 credit with getting help in time. This isn't just theory, it's backed by real science and senior care professionals. And today, you're not only going to learn this 1-minute stroke test for seniors, but I'll also reveal a bonus hand strength check most people have never heard of used in early stroke detection. So make sure you watch till the end, because this could be the most important video you'll see this year for your health or your parents' safety. As we age, our risk of stroke increases significantly. Seniors, especially those over the age of 60, face a much higher likelihood of experiencing a stroke due to several factors such as high blood pressure, diabetes, high cholesterol, and limited physical activity. The blood vessels in older adults tend to harden or narrow over time, making it easier for clots to form and block blood flow to the brain. This is why it's so important to understand the early stroke signs in elderly individuals and to know how to perform a quick and reliable stroke test for seniors at home. In fact, strokes are the 5th leading cause of death and a leading cause of long-term disability, especially in people aged 60 and above. Taking preventive action and learning how to recognize stroke symptoms early can make all the difference between life and death, or between full recovery and permanent disability. One of the most trusted and widely recommended methods for detecting early stroke signs is the FAST test for stroke. It's a 1-minute stroke test for seniors that anyone can perform, no medical training needed. The word FAST stands for face, arms, speech, and time. Let's break it down. F stands for face. Ask the person to smile. Look closely. Does one side of their face droop or look uneven? Facial drooping is one of the most common stroke symptoms after 60 and should not be ignored. A stands for arms. Ask the person to raise both arms. Can they lift them equally? Or does one arm drift downward? Weakness or numbness in one arm is a key warning sign that the brain may not be sending signals properly. This is a critical indicator in stroke detection. S stands for speech. Ask them to repeat a simple sentence like, "Today is a sunny day." Are the words slurred, garbled, or completely incoherent? Trouble speaking clearly is often one of the first signs of stroke in elderly people. T stands for time. If you notice any of these signs, it's time to call 911 immediately. Don't wait. Every second counts when it comes to stroke treatment and survival. This stroke test for seniors takes less than a minute, but it can be the difference between timely medical care and a life-altering outcome. Encourage your loved ones to practice this regularly, especially if they have any stroke risk factors. To understand just how urgent stroke prevention is, let's look at the numbers. According to the CDC, someone in the United States has a stroke every 40 seconds. And every 3.5 minutes, someone dies from one. These are not just cold statistics, these are real people, often seniors over 60, who didn't get help in time. You may have heard stories of seniors who went to bed feeling fine and woke up unable to speak or move one side of their body. That's how fast and silently a stroke can strike. In many cases, the stroke could have been caught earlier if someone had done a simple 1-minute stroke test at home using the FAST method. That's why we're urging every senior citizen, caregiver, and family member watching this video to learn and regularly use this stroke test for seniors, because when a stroke strikes, time lost is brain lost. Now that you've learned the 1-minute stroke test for seniors, and don't keep this information to yourself, put it into practice today. Try this simple yet life-saving stroke test with your spouse, friend, or an elderly loved one. Even if they seem perfectly healthy, it's important to make this a part of your regular health routine. Knowing how to check for stroke at home can help you detect early signs before they become fatal. If you notice any of the warning signs we discussed, whether it's facial drooping, arm weakness, slurred speech, or sudden loss of grip strength, do not wait. Call 911 immediately. In stroke care, every minute matters, and getting help fast can prevent brain damage, disability, or even death. So please share this video with other seniors, caregivers, or family members who need to know this information. Let's work together to raise awareness, take action, and protect our senior community from stroke risks before it's too late.